What's up, y'all? Welcome back to my channel. I ain't playing with Rona out here. We gotta go to the store, so.
Yes, sir.
We ain't playing. Masks made by my daughter, a little 14-year-old genius. So today I'm gonna talk about how America's dirty little secret just got blew up. It ain't a little dirty secret no more now, is it? It's still dirty though. Stay tuned. Everyone seems to be so alarmed and shocked about the eerily disproportionate number of deaths in the Black community from COVID-19, except for, well, Black people. This is the reason why. For us, this is nothing new. Racial health disparities has been the longest unkept secret since, forever. What we are shocked about is that our counterparts are finally paying attention, and this is probably because Corona, or the Rona, as we like to call it, has blown up this country's dirty little secret with hardcore statistics. Yep, this is real. So what are we going to do about it? Let's look at some of the reasons for these health disparities amongst Black and brown people and what we as social workers and advocates can do about it. David Williams, a professor of public health at Harvard University, accurately conveyed this plight in a recent article I read when he stated, "When you look at COVID-19, that particularly is virulent for persons who have higher rates of disease, that's exactly the picture of African Americans. But it's not their genes, it's the social conditions that we have created." But what social conditions is he talking about? Here are the top 3. African Americans are more likely to live in places near contaminated air, water, or soil, which extremely negatively impacts their physical and mental health. The very presence of these pollutants increases rates of the very underlying chronic diseases that makes one more likely to die from COVID-19. America's public housing communities are often largely populated with African American families and has been historically known to have unlivable and inhumane conditions. Right here in Annapolis, Maryland, the discriminate nature of our own public housing communities recently hit news circuits due to the large presence of mold that had gone untreated in many of the units. Families and children were inundated with breathing issues and the development of asthma as a result. COVID-19 has also once again exposed the racial bias and discrimination which occurs in healthcare systems all across the country. Just as the AIDS and opioid epidemic ravaged communities of color at disproportionate rates many years ago, Corona has done the same. And equally the same as with the AIDS and opioid epidemic, more attention is given to whites from medical practitioners due to the belief that Blacks are more resilient to pain and suffering and do not need as much medical attention. Because of the history of bias and discrimination, distrust of the medical community by African Americans could have played a role in unwillingness to go and seek treatment for developing symptoms of COVID-19. Black people are overrepresented in a good portion of the industries that required non-virtual work during this pandemic, to include essential positions such as grocery workers, food industry workers, and hotel industries, thus making it very hard to social distance. In addition, due to higher rates of poverty in African American communities, many felt the need to continue to try to make money outside of the home to survive. As you can imagine, penetrating highly professional industries are not easy for Blacks due to the system of racism which works so hard to keep them out. So what can we as social workers, mental health practitioners, and advocates do about this? Well, let's start off with mental health practitioners. When you're working one-on-one with your clients, it is so important for you to educate your clients on these health disparities and let them know that it is so important to stay at home during this pandemic. As for macro social workers and advocates, it's time to do what we do best and advocate. We have to fight to remedy these underlying injustices. We have to work hard to improve housing, air quality, education, and job opportunities for Black people and communities of color. It's not enough to just be aware of the social injustices and the systematic racism that continues to plague people of color all across this country. We got to do something about it. So, who's with me? Silence on such devastating issues is an endorsement of it. If you found this video helpful, don't forget to hit that like button. And of course, please subscribe. Thank you, and I love you all. See you soon.